Here are some tips.
Inattentiveness, hyperactivity, and impulsiveness are all characteristics of attention deficit hyperactivity disorder, or ADHD. These types of symptoms can affect your daily life, including your sex life. Some people with ADHD struggle concentrating. In the bedroom, the lack of focus can translate into disinterest and could even lead to struggling with orgasms. For someone struggling with hypersensitivity, something that feels good to you may not feel good for them. Hypersensitivity can also lead to mood swings. When you like something one day and not the next, it can be confusing for your partner. Other issues could be caused by having a high libido and feelings of anger and loneliness. Fortunately, managing ADHD symptoms can help with most romantic issues. Talk to your doctor about your symptoms and make sure you're taking your medication. While most ADHD medications won't affect your sexual functioning, you'll want to make sure you're taking something that works for you. Most medications will allow for better sex by helping with issues like focus. Let your partner in on how ADHD affects you. Talk to them about your symptoms so that they know some issues that may be rooted in ADHD and not your disinterest in sex. And continue to talk when you're being intimate. Let them know what you like and want so there's less guesswork and less room for confusion. You can also make changes in your environment. Too unfocused? Try dimming the lights and making small changes to limit any distractions. Therapy can also be helpful. A therapist can help minimize ADHD symptoms and provide helpful communications tools.
Another tip to help with focus is exercise. Of course you know it's good for you, but it can be especially helpful for the brain. Let's take on some more questions.
A woman says, I've been divorced for 10 years, but I want a relationship like I see in the movies. How do you meet a man like that?
Well, what you see in the movies is called romantic ideology or idealized love. Love that's unconditional, one where the partner is everything to their lover. Reality is just different. No one is perfect. We all have our faults, and even the best relationships have their up and downs. Having said that, there are many relationships that are long-lasting and full of romance.
Talk about reality. I'm sorry, I talk about reality because she asked about, you mentioned the movies, and she mentioned the movies. Also, watching porn is not real. It's physically, it might be deceiving, and you might be thinking you're not quite there as a girl or a man.
Yeah, absolutely, absolutely. I mean, there's a lot of people now, access to porn, you can get anywhere on a cell phone. And so there are people that are seeing it at younger and younger ages and expecting their first experience to just be like that. And that's just, unfortunately, not how it works.
Right. Are there any risks in looking for the idealized or unconditional love?
Yeah, absolutely. There are risks for looking for that type of love, like unhappiness when you can't find it, and the possibility you might overlook a relationship that could have been the one. There are also risks for not looking for romantic love. Seeing your loved one through these rose-tinted glasses helps enhance your love and sometimes ignores the unpleasant aspects of the relationship. Promising internal love could encourage you and your partner to put more into the relationship and make it work. But you need to keep an optimistic outlook. You will find someone special that increases your motivation to look for them. One thing to keep in mind is that most adults find the one through introductions from family and friends, so just let them know that you're looking.
I imagine also they can also find it if they go to certain clubs or meetups or churches. I mean, are there any statistics on this?
Yeah, actually, I just read one. So 18% of people say they met through work, 17 through school, 12 on online dating, and 8 or a bar or restaurant.
Just out of curiosity for the thousands of viewers, you're married, so guys, she's off the market. How did you meet your husband?
I actually met him walking out of a bar. He was staring at me, and I kind of looked back and then looked away, and he kept staring. And so then I just said, hey, I'm Leah. It was really that simple. But he's an amazing man, and if I didn't walk up and say hi, I was with a guy friend, and he thought that was my person, so he didn't want to be rude. But so, I mean, for everybody out there, there's nothing wrong with walking up and saying hello. That was all I did.
A woman wants to know, are there any supplements I can take to reduce the symptoms of menopause?
Well, here are some you can try. The first is evening primrose oil. It is usually used to treat hot flashes and bone loss, but the results are mixed. One study said it wasn't effective yet. Another study showed that the oil was 10% more effective than the placebo in reducing hot flash severity. Another study looked at bone loss, and a supplement of evening primrose oil combined with calcium and omega-3 did help retain bone mineral density, but no more than just a calcium supplement. Maca is a Peruvian vegetable and has been used to treat hormonal imbalances and certain other menopause symptoms. Small studies show that it is much more effective than placebo for increasing sex drive and reducing symptoms of anxiety and depression. So you want to check with your doctor just to make sure that maca doesn't interfere with any medications that you're taking, but it shouldn't. It's a pretty safe supplement.
And you've done a lot of research on maca.
Yes, I have. I've done a lot of research on maca. I looked at in terms of overall sexual functioning and strength and memory and mood. What I found is that although there were changes in pre and post maca and placebo, women were very much affected by the placebo effect. Men were not. So I found that it was only statistically significant in men, but there's a bunch of different types of maca, red, yellow, black. So it could have just been that type. So I'm not saying that's not going to work for all women, but in my study, I found that it was much more effective for men.
Those are great, Dr. Leo. What are the other ones we can try?
Well, soybean is thought to relieve the symptoms of menopause since many of them are related to a decrease in estrogen, but the results again are mixed. Some studies found that using soy supplements may affect bone health and reduce the frequency and duration of hot flashes. That being said, you should certainly go to your doctor who can help you ease these menopause symptoms.
And Dr. Leo, here's our final question for the day. A male viewer, and I'm sure probably hundreds or thousands more would like to know the answer. How can I last longer in bed?
Well, there are things you can do to last longer, but first see if the problem is premature ejaculation. While there's no set time to define premature ejaculation, some professionals say that it ranges from anywhere 2 to 3 minutes, while others define it at 1 minute. Medications can help, like selective serotonin reuptake inhibitors, which can change sexual function and may help delay ejaculation. Viagra can help you retain your erection after ejaculation, allowing you to continue having sex with your partner.
You mentioned numbing. There's also numbing creams and sprays?
Yeah, there are numbing creams and sprays that can help you. You can apply to the head of the penis that will help desensitize it. You'll need to apply them 20 minutes before intercourse and make sure to rinse them off before having sex so they don't prevent you from getting an erection or passing it off to your partner. You don't want them numb, right? Using a condom can also help dulling the sensation, and foreplay is a great way to pleasure your partner and even bring them to climax before intercourse. Studies have shown that the majority of women say that they need clitoral stimulation to reach orgasm. If you want to experiment on your own, try masturbating with a sex toy and stopping right before orgasm, or waiting a few moments and then try again.
Oh, good to know. Okay. Also, the gentleman asks, you answer kind of more like medical. Maybe, I don't know if he's, when he says lasts longer in bed, maybe it's physically, maybe like an older person sometimes or not, runs out of air or something.
Well, that is true. If the problem is not a premature ejaculation or erectile dysfunction, if the problem is just your cardiovascular health, then you're definitely going to want to do things to get that up, running, biking, swimming, things of that nature. And there's also, there's certain positions, I think a lot of ladies can agree with this, that if you did leg day, your legs are going to be more sore in certain positions. So if you're strengthening those muscles, quads, hamstrings, glutes, hip flexors, core, all of those are going to be muscles that are used while you're having sex.
Okay, so Dr. Leah, so having a partner when you're working out has accountability and helps you out. How about having a partner to help this gentleman's situation?
Yeah, there are similar techniques that you can try with your partner. Have them stimulate your penis until you're ready to ejaculate, and then stop until the urge decreases. Also, there's breathing techniques, so try breathing in deeply and out as you're close to ejaculation, or visualize something that's not related to sex when you're close. So sex therapy with your partner can also help. You may have an underlying issue such as anxiety that's causing the problem.
Can we clarify something about, you mentioned sex therapy. What's typical sex therapy? It's probably not what everybody is imagining in their minds, what's happening in a sex therapy session.
Well,
right?
there isn't a typical sex therapy session. It is all across the board. So there's some that are going to be dealing with emotional issues, some that are going to be dealing with physiological issues. And actually what's legal versus what's not legal varies from state to state. I know California is a little more progressive in terms of what is allowed in sex therapy, and those types of practices would get you arrested in the state of Florida. So there isn't one traditional sex therapy.
Okay, good to know.
All right. Well, Derek, that's all the time we have for today. But you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always